Good afternoon, everyone. Welcome to our Erie County COVID-19 update for February 16th, 2021. We'll be joined soon by Dr. Gail Burstein, our Commissioner of Health, and we're also joined today by Kendra Schmidt of Deaf Access Services. We have quite a bit of information to go through, including some stuff that's basically hot off the press. Just the overall top line, so to speak, since the beginning of the pandemic through February 14th, there are 60,430 confirmed unique COVID-19 cases in Erie County. That means 60,430 people we have confirmed have had COVID-19. The 7-day positivity rate has dropped to 4.8%. That's good. We'll continue to see a drop in the positivity rate. Hospitalizations effective as of the 14th. There were 280 COVID-19 patients in Western New York, with 58 of them in the ICU. And of those 280 COVID-19 patients in Western New York, 230 were in Erie County hospitals, 50 were in the ICU, 36 were on an airway assist. Unfortunately, 3 individuals died on the 14th, and 39% of the patients were 64 and under on February 14th. And with regard to the 230 patients in the Erie County hospitals, this is the lowest we've been in quite some time. And it's actually lower than the high that we had in the spring. So we are headed in the right direction with being downward. You can see our diagnostic testing summary with the week ending on the most recent full week of February 13th of a 4.7%. We said just the slide before it was 4.8%. That's because that was effective as of the 14th. This is a week-to-week analysis. With the week ending the 13th, you'll see it has dropped to 4.7%, and we have continued to see a nice little drop in the last few weeks. New cases have declined 4 weeks in a row. They're down 6% from the previous week, and the number of reported diagnostic tests are steady from the prior week, though still significantly down from about a month ago. When it comes to new cases, the town of West Seneca, 14224 zip code, unfortunately had the most new cases and one of the highest positivity rates for all of the county. At 6.7% and 130 new cases. The town of Hamburg was second with 121 cases in 14075 zip code with a 5.5% positivity rate. The third was the Amherst Williamsville Clarence zip code of 14221 with 116 cases, but the positivity rate was a lot lower at 3.8%. You will see there are some areas on here. Town of Aurora was 6.6%. South Buffalo, 14220, 6.3%. So not everybody's where we want them to be. We would prefer that everyone was actually below 3%. And there are some categories in the 3% area, but there are others that are still in the 5s and the 6s, and we need to see that go down if we're going to continue to see our overall positivity rate go down and truthfully be in a better situation for COVID-19. Hospitalization rate. We talked about this number. 230 people were hospitalized on the 14th in Erie County hospitals. 22% of all hospitalizations required an individual in an ICU bed, and that's kind of where we've been for a while. At one point it was about 25%. Of course, earlier in the year it was a little higher. Or I should say early in 2020 it was higher. The one thing we've seen as the hospitalizations have dropped is we've also seen a slight uptick in the number of individuals who are COVID-19 positive that are under the age of 65. It's basically 40% of the population in the hospital are 65 and under that have COVID-19. And we know that anyone can get COVID-19 and any age can get COVID-19 and be hospitalized, because we've seen the data that shows throughout the COVID-19 pandemic, the youngest patient was under the age of 1. Newborns, unfortunately, have had COVID-19. Though thankfully all seem to have recovered in our area. The mortality data, we unfortunately did announce yesterday some increased deaths. There are 59 individuals who died of COVID-19 that are Erie County residents in February 21, and the data is effective as of the February 12th. And in total, unfortunately, 1,601 individuals have died in Erie County from COVID-19. We know that number is going to go up because there have been some hospital deaths, though we need to confirm that the individuals who died in the hospital deaths since then were actually Erie County residents. But once again, this is still taking lives in our community. We've had 2 people in the month of February alone who are under the age of 40 who've died from COVID-19 that are Erie County residents. So it's not just the old people who are passing. And once again, we always offer our deepest condolences and sympathies to the loved ones and family members and friends of those who've lost someone they care about deeply as a result of the terrible pandemic. Erie County responds. It's not even in the chart or in the presentation because it's so new, and I'll turn most of this over to Dr. Burstein. But I was just recently on a phone call with Governor Cuomo in regards to what we should anticipate in the next 3 to 4 weeks. And we do anticipate to receive some additional doses, approximately 5% increase. Not a huge amount, but what they've been told by the federal government is there'll be a little bit increase. Now, I don't know if those are going solely to the county or if they will be going to pharmacies, federal qualified health centers, all of whom are receiving doses at this point. But we do anticipate an increase of doses to our community and all counties, for that matter, across New York State. And then also something that's come out of it is the governor announced that they are planning on doing mass vaccination centers, working with the counties across New York State in conjunction with the National Guard. I have immediately, I should say, though we put the request in beforehand, I immediately responded saying the county wants to partner with the state on opening a mass vaccination site that would be a 24-hour, 7-day-a-week site at the convention center. We believe we'd be able to do over 3,000 doses a day at the convention center, possibly more depending on how many individuals we receive from the National Guard. This is not something that's going to open immediately, but it is something that we believe, hopefully within a month, we'll have a super mass vaccination site open at the convention center with a combination of the county and the state working together with the National Guard. I know people are not happy with the vaccine delivery. We want more vaccine delivery to our community. We want to be able to get more vaccines into the arms of our residents, but we are at the mercy of whatever the state sends us, and the state is at the mercy of whatever the federal government sends us. Governor Cuomo noted yesterday he was in the White House with other governors meeting with President Biden, and the president assured them that they will be getting more doses soon. When? We don't know exactly. But the president assured them that is their plan to vaccinate 300 million Americans with both doses by the end of June, which means there would be a tremendous ramp up in a short period of time to get those doses into the arms of our residents and across the country. We know we've done approximately 100,000 residents with a first dose right now in total, and over 40,000 Erie County residents have received both doses. That number will increase. We get updated numbers on a weekly basis from New York State. I'm happy that we're above the state and national averages with the percentage of individuals in our community who've received doses. We were over 10% for those who've received a single dose and over 4% for those who have received 2 doses as of last Thursday. I know that number has gone up since then. I'm happy we're above the state and national averages, but I know we can do more. And that's why we are going to, if not in the immediate future, within the next few weeks, be opening up a mass vaccination site at the Buffalo Niagara Convention Center to do thousands of individuals a day, 24 hours a day, 7 days a week. The reason it hasn't been opened yet is because we don't have the vaccines to do it. As Dr. Burstein will talk, we really haven't had that many vaccines at all to do it. And I can confirm, last week, between the county Department of Health, pharmacies, federally qualified health centers, and others, there was a little over 8,000 doses sent for our community in Erie County. Now, if we're going to be doing a mass vaccination site, we could do at least 3,000 doses a day. So 8,000 doses is not going to cut it for a week, but 3,000 doses, doesn't take a genius to realize, if you're doing 3,000 to 4,000 doses a day at a mass vaccination site, within a few weeks you could be doing hundreds of thousands of residents. And with that, I'm going to turn it over to Dr. Burstein to talk a lot more about vaccines and more about where we are today and the plan for the upcoming week as compared to what I just talked about, which is where I expect us to be in a few weeks. So, Dr. Burstein.
Thanks. Thank you. Good afternoon. So as the county executive mentioned, I'm going to give you some more specific details about where we are with vaccines in Erie County. We're not quite at 3,000 doses a day. However, we are ready to get there. So through February 15th, Erie County Health Department has administered 20,586 first doses and 14,935 second doses. So, and then through February 11th, of all of Erie County residents, 10%, which is specifically 94,986, have already received a first dose of vaccine, and over 4%, specifically 40,825, have received a second dose of vaccine. And we get those updates every Friday, and we will update you this coming Friday. So as you remember, we had to cancel many appointments in January for vaccines because we didn't receive the supply that we had anticipated. So for this week, we anticipate receiving, weather permitting, and I have to say that the source of our vaccine shipments are Texas, so we're assuming that these shipments will be 1 or 2 days late. However, when we do eventually receive the shipments, we are going to receive 1,700 doses for our Erie County Health Department first dose pods. And remember, we are rescheduling those canceled appointments right now in Erie County. And then we're also receiving 300 doses for people with developmental disability living in congregate living settings and their staff. We are rescheduling these January appointments, as I mentioned earlier, and as of now, we're up to rescheduling people who we have canceled through January 26. So if you have one of these people that had an appointment before January 26 and you think you haven't heard from us, please check your email. Check your spam folders or your junk folders. We're finding that a lot of people have discovered when they've gone data mining in their emails, they've found our emails in those folders. So please check those folders if you're in that category and you haven't already received an email from us. So just talking about the new eligibility requirements, I know there are a lot of questions about that. So as of today, February 15th, people with certain medical conditions are eligible for COVID-19 vaccine. So this week, the state health department is shipping us 1,600 doses for this specific population. And what we are doing in Erie County is we are providing this allotment to hospitals for their most at-risk patients. So the hospitals will be immunizing those individuals who are their patients with this allotment. The county will not be immunizing those people with those chronic conditions. So moving on to schools. So if you recall, at the end of last week, CDC issued new guidelines and tools and resources to help counties and school districts open up schools again. So in that guidelines, there were some tools looking at when counties should consider reopening up classrooms. And the CDC has a specific indicators and thresholds for community transmission of COVID-19 to help guide schools about how they should open up. So unfortunately, Erie County, with our numbers right now, we are in the high transmission red zone category. So we still have a long way to go to bring these numbers down, according to CDC, to be able to fully open up schools in person, as we all want to do. So reducing community transmission is the critical factor in maintaining in-person learning and reopening not only schools, but also other parts of the community. And CDC provides guidance, 5 steps of what we need to do to bring down those numbers so we can reopen up in-person classrooms 100%. So this is something you've all heard report. So universal and correct mask wearing, and right now CDC actually recommends double masking, and if you'll notice, the county executive and I are wearing double masks. Social distancing, hand washing, and good respiratory etiquette, cleaning and maintaining healthy facilities, and contact tracing in combination with isolation and quarantine. So we really need people in the community to cooperate with the Erie County Health Department and answer the phone when we call you, and make sure that you stay in isolation for the full 10 days and give us who all your close contacts are so we can contact them and put them in quarantine. So just a little bit more about updates, what's going on with COVID-19 in the schools, K through 12. Unfortunately, when we look at our data, we see that school staff are really overrepresented in the school-related COVID-19 cases. Compared to the population of staff in schools, is a lot smaller than all the students in schools, but we're seeing a higher proportion of staff who are COVID-19 positive compared to the population that are actually working in the schools. So, and then the typical stories that we're hearing from our contact tracers is that staff are eating and gathering in break rooms. They're just hanging out together in break rooms, sometimes without masks, and they're having many in-person meetings instead of being able to have meetings virtually by Zoom or WebEx. So we're asking school administrators to really discourage use of the break rooms at all. You don't need to have a break room if you're not going to have lunch together, hang out together, and then move all the in-person meetings to some type of video conference, or else if you need an in-person meeting, make sure that you meet in a larger space like the auditorium or cafeteria, and there's adequate physical distancing between each person. Just talking about our diagnostic testing, moving on to that for COVID-19. So and remember, part of the big push to bring our numbers down is making sure that everybody knows their status, that everybody will know if they are infected with COVID-19 or not. So that's how we start breaking the chain of transmission. So if you want to know your status and you want to get an appointment from the Erie County Health Department, call 716-858-2929. So any Erie County resident, for any reason that you want to get tested, is eligible for COVID-19 testing. We are doing the PCR testing, which some people are calling molecular testing, just based on what they need for travel. And we're able to turn those around in 1 to 3 business days. And then we're also doing the point of care, which is the rapid testing. Right now, that's the antigen testing, and that is available on site, and you will get your results immediately. So with that, I'm going to turn it over to the county executive for questions and answers. Put on my double mask apparatus.
Thank you, Dr. Gale. With that, we'll start. I think we started at the bottom of my list last week, so we'll start from the top of my list, and the top of my list is WKBW Television. I think Ashley Rose on. Ashley, do you have a question?
Yeah, hi, Mark. Last week you had mentioned that you were still waiting on some guidance around testing for weddings and vaccination requirements, all that stuff. So what more information do you have about weddings and the requirements for testing and all that?
I have no additional information. We have not received any additional information from New York State. We don't. It's not unheard of for New York State to announce the plan, but then issue the guidance some days afterwards. But as of right now, we don't have any further guidance from New York State as to how testing would be performed, who has to perform it. And that's all I can offer on that subject matter.
How frustrating is that for you and your team, getting these sort of sporadic updates and new requirements and new restriction relaxations from the state, but not having the guidance to be able to provide your constituents with the answers that they are looking for?
Well, there's unfortunately lots of different things that we receive information on daily from the state with regards to the COVID-19 response that we don't always get the immediate guidance on. And vaccines is a good example of that. I think you'll remember it wasn't that long ago that the state announced that they could do immunocompromised, and then there was no guidance, and then they pulled it back, and now they're included as part of the comorbid population. So it happens, and I think people need to understand that we are in a once-in-our-lifetime, hopefully, global pandemic in which there's a lot of things that are being learned on the fly, and as they learn more information, they share it with us, but it doesn't always come daily. I know people aren't happy with it, but if you had our jobs and you were here daily, you'd be inundated with data, because that's what ends up happening. We get so much information that's coming from the state, but often the stuff that they announce, we might not get it for 4 or 5 days or a week later. But we're getting so much information from the state, and we're constantly updating our regs, we're constantly updating our procedures as a result of it. Dr. Burstein and I were talking multiple times over the weekend, not just emailing, talking multiple times over the weekend about different issues that we had to deal with as we got more information from the state with regards to vaccine delivery and testing and other aspects. And it's just a constant flow of information. And while we may not get the one thing that people want that day, we can continue to put pressure on the state to give us the information as quickly as they can. But on this situation here, because you have individuals who'd be coming from outside the area in all likelihood, and testing that would have to be done within a certain time period, we're still waiting for guidance on it. And I can tell you, just knowing the capability that we have of PCR testing, if a PCR test is required for every wedding party that wants to have 100 guests, we're not going to be able to do that in a 2 or 3 day period before the wedding. We just don't have the capability of doing thousands of PCR tests in a very short period of time. So that's why we're waiting for the guidance from New York State, because this is going to apply everywhere, whether it's Erie County, Niagara County, Chautauqua County, Tompkins County, Suffolk County. Doesn't matter. It's going to apply everywhere, and that's why we have to wait for the guidance. WIVB, Channel 4, Chris Orvadas.
Hey, Executive. The convention center, would these be appointments that are set up through the county? I know you said you want to work with the state, but I'm just wondering if these are appointments that would be set up through the county, and is the opening date for whenever you open that, if it comes to fruition, exclusively dependent on when supply ramps up, or are there other things at play there?
We would not open the convention center until we have adequate supply to handle a facility such as that. The cost associated with opening the convention center is not inexpensive. We're talking approximately about $10,000 to run that place and have it open for a week. So we're not going to open it until we have vaccine capability of doing a mass vaccination site. We have multiple clinics going on right now that are capable of doing over 700 doses a day, but it would be silly to move one of those clinics to the convention center, which is so huge that could do thousands of doses a day. We do not anticipate that being open until we knew we had the doses for it. And with regards to your first question, I'm not exactly certain how we would do the appointments for that. I can confirm that the Erie County Department of Health and our IT department is in conversations with Microsoft to bring to Erie County the same system that's being used in a couple states and other large counties across the United States. We've been unhappy with the appointment scheduling system. It is the system that the state has. It's not perfect, no perfect system is, but we think there's a better chance. So Erie County is looking at very soon working with Microsoft to create an appointment-based system that will be a much better flowing system for our own internal clinics, and then that potentially could be used for a mass vaccination site at the convention center, but we'd cross that bridge when we come up to it. WGRZ TV, Channel 2, Dave McKinley.
Yes, good afternoon, Mr. Executive.
Hi, David.
Yes, sir. Just to follow up on Chris's question, it would seem to me that you were anticipating a lot more vaccine coming, because you wouldn't even suggest this at those numbers unless you pretty much confirmed that you believe it's coming. And the other question I have regarding that is about the personnel you would need and whether you have those. And when you talk about vaccine sites, would you propose, if you had a mass vaccination site, that you would be closing all these other sites and just have everything at one site?
All of that is on the table, David. That is definitely an option. One of the things that the governor noted, and we actually had received prior information of, is that the National Guard was ramping up for this potential of doing mass vaccination sites across New York State. It certainly makes sense to have a mass vaccination site in Buffalo because of the size of our population. Might not make sense to do a 2,000-person mass vaccination site in Allegheny County, but it certainly makes sense to have it here. So we have anticipated this. That's why we've been having these conversations with Microsoft about developing our own appointment system. knowing that there's a very good chance, if not in February, sometime in March, we would have thousands and thousands of more doses. This would be a coordinated effort between the county, the state, and the National Guard. It might make sense at that point for the county to close its 2 first-dose clinics that we otherwise have going on at, truthfully, ECC South and ECC North. Those are appointment-only clinics. You can't just walk in. You got to have an appointment, but it might make sense in the future for us to close those clinics and just have one mass vaccination site in downtown Buffalo for not just Erie County, but potentially the region. But we know that we've been unhappy with the way the appointment system has been working, so that's why we've reached out and we've started this relationship with Microsoft. And if things go well, hopefully we'll be able to implement that in the next couple of weeks. It's not, the way this is working, and I told people, there's nothing associated with the delivery of vaccines was going to be set in stone. It was always going to be a work in progress. It's not at where we want it to be. It's as simple as that. We wish we had more vaccines. We wish we had more appointments available for our public here, but we can only schedule appointments based on the number of vaccines we have. So we would not open a mass vaccination site at the convention center until we knew we had sufficient vaccines to deliver at that in a weekly basis and the staff capable of doing it. I think working with the state, the National Guard, and our own county staff, I think we easily could do that. But it's all going to be dependent on vaccine. And the conversation that the governor had with myself and other county executives today is, I know you're preparing for it. Based on what the president told him yesterday, you should start anticipating this, maybe not next week, maybe not the week after that, but possibly by the middle of March, possibly by the first week in April, which means we need to get our ducks in a row now, and that's what we're doing. Spectrum News, Aaron Ty.
Yeah, hi, Mark. Just wondering what went into the county's decision of using the convention center rather than, let's say, Dole Stadium, which has a little bit more parking and more space to work with.
2 things. Number one, we're learning from those who are doing drive-through vaccination sites across the United States that they have to shut down those vaccination sites in cold weather. And it does not make sense because you have to have people wait 15 minutes after the vaccine, but there's also storage issues and delivery issues when it is so cold out. And we know, this is Buffalo, it can still get cold in March and April, it can snow in May. So it doesn't make sense to utilize an outdoor facility at a time when we could still have very cold temperatures. And what's happening at a lot of those places that had drive-through facilities, they had to shut down, not because of power issues, but because of cold issues. And actually at the end, I'll talk a little bit because yesterday I was on the phone with my counterpart in Harris County, Texas, Lena Hidalgo, and so was Dan Neverth, our Homeland Security and Emergency Services Commissioner, to try to assist them with the issues they're dealing with because of the extreme cold down there. But they've had to shut down all their clinics. They had Clay Jenkins, the county judge in Dallas, they had to shut down their drive-through clinics even before the snowstorm once it got cold. So the primary reason we're trying to avoid, at least now, drive-through clinics is because of the cold and the issues you have with delivering vaccine in the cold. Now, in June, would it make sense to potentially use the football stadium and the parking lots? Yes, it would. But for March and April, it doesn't. WBFO. Anybody on from BFO? BFO? Guess it's a pledge week again. WBEN. Anybody on from WBEN? All right. Paul, go ahead with your question.
Are there going to be more pop-ups, vaccination sites? Because it seems like, poor people and especially the elderly. I know my mom, no way could she navigate through a computer, even if we're helping her. And my mother-in-law the same way, is just to get on and to register and all that. Are there going to be more pop-ups so people can come in there and technically, maybe they have a reservation, maybe they don't?
The question is, are there going to be more pop-up clinics? The state didn't do pop-up clinics this past week, but what they did do is they gave doses to federally qualified health centers. And I do know in the last week, Jericho Road as well as I think Neighborhood Health, both received hundreds of doses of the vaccine to administer for their patients and population, which generally are in underserved communities. What the governor talked about today with regards to pop-up is still there's going to be need for pop-ups. But as we get more doses, we're going to need mass vaccination sites, pharmacies, federally qualified health centers, other doctors' offices that can deliver the doses. I do know that in the past week, as I said, federally qualified health centers and pharmacies both received doses. The president announced yesterday, and the governor talked about it, that the federal government is going to send more doses starting in the next week to federally qualified health centers and pharmacies directly. So there's more doses available in communities rather than at a mass vaccination site. So I'm hopeful that there will be more doses available for all different types of delivery. We know that you cannot rely on just one site. You have to have multiple sites. And I do know that in the next week, the federally qualified health centers and pharmacies should be expecting more doses because they're going to come directly from the federal government, and they're probably going to get some allocation from New York State as well. Okay, BEN, anybody on from BEN? If not, Buffalo News?
I apologize. I was having some technical difficulties logging on. The county had previously only been vaccinating, offering, diagnostic testing to folks who showed symptoms or were close contact, because there was some concern about not having enough capacity to do all these tests. So I'm just wondering what has changed that now. I just want to confirm again that the health department will be able to offer diagnostic COVID-19 tests, either the PCR tests or rapid tests to anyone who requests one.
That is correct. I will turn it over to Dr. Burstein to talk a little bit more, but it really just comes down to the amount of supply of testing we can do and what the demand is currently.
Thanks. Hi, Sandy. So our public health lab is very fortunate to finally have received a new platform, some new equipment that we ordered months ago, and it's finally arrived. So this new PCR test is fully automated, and so we can do many more, maybe even double what we were able to do before of the number of PCR tests. Also, CDC has a new test that they've been sending us, the multiplex test, and so we can do that requires less specimen used up for each plate, so we can put more specimens in per run. So that is also increasing our capacity for PCR testing. So we are, in general, able to do much more, probably double the number of PCR tests as we had previously before we received this new equipment and the new CDC test. So we're really excited about that. Also, demand is down, seems to be down for testing all over. You can see from our Erie County data that in general, less people have tested in February than had been tested in December and January. So, COVID-19 the numbers are coming down. However, it's still here, and people still need to know their status to be able to appropriately isolate and quarantine and bring down the chain of transmission. Thanks.
So just to clarify, the new multiplex test that requires less material to test each sample, is that a good way to describe it?
Right. The new CDC test. So with the old CDC test, we had to fill like a certain number of wells with specimens. And now with this new test, we only need to fill a smaller number of wells per each specimen, so we can put more specimens into each run, because a lower number of wells need to be filled per each specimen. Also, the multiplex does flu testing too, so for those individuals that get tested with the CDC's multiplex test, they will also get a flu test. However, the other test that we have, the new machine that we have, the pneumatics, is completely automated, and so that's really where we're getting our big increase in testing is from that new PCR test.
Thanks.
Sure.
Is anybody else I didn't call on? And then we'll do one more round of questions. WKBW TV, Ashley Rowe, any other questions?
Yeah, thanks. Just one more quick question. The federal government, according to the state, the federal government has increased the weekly supply of vaccine by more than 20% over the next 3 weeks. That's to the whole state, and that was announced by the state 2 days ago. But so why is it that Erie County, and I don't want to discount the 5% increase, but 5% is much different than 20%. Why is that so different? Where's the discrepancy?
Well, they're not necessarily giving it all to the county health departments. They're giving it to, like last week, the federally qualified health centers were basically received their first doses of any substantial amount. Pharmacies, there were more pharmacies. I said there was a little over 8,000 doses that were distributed. We still don't know how many are coming in Erie County for the upcoming week. We don't get all the doses. And I truthfully don't know how many the state's holding itself for its state sites. My understanding is the UB South site is booked all the way through April. So I don't know how many doses they're doing per day at the UB South site. So they may have increased the amount of doses at the UB South site due to the demand and the appointments they have. But we wish we got more for Erie County. We'd take them. But for now, it's kind of out of our hands. We're at the mercy of how it's distributed by the state. And once again, they distribute it based on population, and we've done a very good job of putting doses into the arms of our citizens. We're at one of the higher percentages of overall dose delivery. So all I can say is it probably was distributed in our community, but it just didn't all go to Erie County. Chris Orvadas, Channel 4.
I'm curious to get your reaction to everything that's happened in Albany over the past week or so. We're hearing more and more Democrats say that they think the governor's emergency powers should be revoked. Do you share that opinion?
Well, the governor, I mean, he announced it yesterday. They should not have withheld the data with regards to the individuals who had died as a result of COVID-19, who may have been a nursing home resident. We've known for some time that individuals were dying in hospitals that were COVID-19 positive, that were nursing home residents, that may not have been included in the nursing home totals, but we didn't know exactly how many. I think you have to also understand there's a problem. You have to have so many categories. What happens if a nursing home resident has a stroke, goes into the hospital, becomes COVID-19 positive in the hospital and dies? Are they a COVID-19 nursing home patient who died? Well, they were a nursing home patient. They died of COVID-19, but maybe they didn't catch it in the nursing home. So there's all these sub-factors that have to be taken into account. I do know that in previous years, deaths were listed by the location. If a nursing home patient died in a nursing home, they were identified as dying in a nursing home. If a nursing home patient died in a hospital from a stroke or whatever it is, they were identified as dying in the hospital. Just like if you died at your home, you're listed as dying at your home, regardless of how the death occurred. So I think the governor addressed it yesterday by noting that they should not have withheld the data. They should have provided more information. I read the full nursing home report. It's pretty scathing, especially on private nursing homes. The one thing that really came out of it that I didn't surprise me, based on the problems we've had here with nursing homes, is the lower rated homes that are for-profit institutions have the highest number of deaths. Basically, if you're in a high rated, a 5-star rated, as rated by CMS, the federal government, your chance of dying in a nursing home, even from COVID-19, or in a hospital from COVID-19, is much less than if you are in a 1- or 2-star nursing home. And you know we've had significant problems with nursing homes in their treatment of individuals. And I know Attorney James's report, Letitia James's report, really, Attorney General Letitia James's report really noted the problems that exist in those low-star nursing homes and the actions that need to be taken. But there can be no denying that the governor's office should not have hid the additional data. They should have released it so the public understood. But in the end, there hasn't been more deaths. It's just been a question of where the individual died and where they may have caught COVID-19. And in the end, we have over 1,600 individuals that have died in Erie County from COVID-19. Some of those individuals are nursing home patients who died of COVID-19 just in the last few weeks. Even after everything that was done, they've still caught COVID-19, possibly being brought in by a staff member. Or as the governor noted yesterday, a delivery man comes to the door and passes it to others. So I think it's important to understand that we're doing all we can in Erie County to protect everyone, regardless of where they live. And for me, I think it was important that the governor came out and noted that they should not have hid that data. We've always been upfront with the data on people where they've died, what town they're dying from, whether they live in the city of Buffalo or they live outside the city of Buffalo, the rates based on race. And we'll continue to do that, and I hope the governor's office and the governor realize that you do not hide information, because otherwise you get what happened in the last few weeks.
Should the emergency powers be revoked?
That's not a decision for me. That's up to the legislature. I have no say in the matter. And most of the emergency powers as it pertains to the governor don't really have a direct impact on county government per se. Simple as that. The legislators I know are thinking about it, but I don't have a say in it, and when it comes down to it, we're going to, whether they revoke his powers or not, we're still going to be providing the same type of service that we have for the people of Erie County for almost a year now. It's hard to believe, but we've been dealing with this for almost a year. It feels like it's been 10 years. WGRZ TV, Dave McKinley.
Last week we were talking about how you were going to decide what best to do with the hospitals in terms of their identifying their patients and getting them for the comorbidity component that you are now involved with. And I know this was addressed earlier. It seems like you've decided on a plan, and the plan is, rather than have hospitals tell you this person needs a shot, where can we send them? You're going to send the doses to the hospitals because they'll know best. If I'm correct in that, it seems like it saves you the headache too of having to schedule appointments because they're going to be doing it. Can you talk a little bit more if I'm on the right track there? And because we've talked to some hospitals that say that that's kind of the way things are going here.
That is the way they are going, David. We had multiple conversations with hospital leaders, and in the end, it was determined that we would identify a certain number of doses that will be allocated to the hospitals in the upcoming week for their comorbid patients, both outpatient and inpatient, based on their patient counts. So the smallest hospital of the four major systems, which is Roswell Park, of course, will be getting the smallest dose number, and Kaleida, which is the largest based on patient counts, will be getting the highest number. And then it's for them to identify with their practitioners who are the most at risk, inpatients and outpatients. Not every inpatient is going to be as at risk as maybe some outpatients. Someone who's a serious transplant issue or renal care who might not be an inpatient but is outpatient waiting a transplant may be much more at risk than somebody who's an inpatient who was just there because they had surgery for a broken leg. So,
and do you know how many doses, Mr. Executive, you might be talking about here to divvy up then to the four major healthcare systems?
1,600.
Per week?
Well, for this first week. If we get more doses in future weeks, then we will look to divvy it up that way and potentially work with others like the federally qualified health centers and others in the healthcare field. I don't know what we're going to get beyond this upcoming week. So we know we're getting 1,600 doses for this upcoming week for the comorbid population. If we get more doses in the future, then we'll be doing the same sort of analysis. If we get less doses, then we'll be looking at that analysis as well. But right now, all I know is about 1,600. And if there's anything I've learned is that don't assume you're going to get more in the future. Because we were told by New York State, go ahead and schedule all those appointments in January, February, and March. And we just said, well, we'll schedule them through January. And then they stopped giving us the doses, and we're still making up those appointments. So I'm only going, and Dr. Burstein is only going, and her staff is only going on what we know is coming. And right now, all we know is coming is 1,600 doses. And even those may be delayed by a day or two as a result of the weather down in Texas because they come from Texas. Aaron from Spectrum, any more questions?
Yeah, one more, Mark. Is the county or any distributor in the county planning on offering any at-home vaccines? It's something that's being done in Monroe County already.
We are not in that position to do it yet. We've had discussions about that, but right now we're not in a position to be able to do Monroe or to do at-home vaccination. We have had conversations with some of the healthcare providers about that. I think they are certainly looking forward to doing at-home vaccinations, but first they need to get the vaccines. So we have had conversations about it, but we're not doing it right now just because we don't have the vaccine supply. We are still making up, I think we're through the 23rd of January, then moving on to the 25th, and we still have a couple more days after that that we'll have to clean up next week with for the January ones. And then when we finally clean off all the appointments, then we can think about rescheduling and seeing what we get at that point. But because we're still cleaning up the vaccine appointments that were canceled, we ourselves as a county are not thinking about doing that in the immediate future, though it is conversations we've had with other parties. And the final question will go back to Sandy Tan from the Buffalo News.
Thank you. Just in regard to the convention center again, how much logistical planning has already been completed by the county? I mean, the convention center is located in a pretty tight downtown area. If you're talking about 3,000 or more folks who'd be funneling through there every day to get the vaccine, I'm just wondering if you could shed a little more light on how you would accomplish that traffic flow and making sure people get in and out, or if you've reached that point in your planning it.
We have started thinking about that. The city of Buffalo has a project in which they're redoing Franklin Street in front of the convention center this year. And the county does have a project where we're redoing the lobby, but that can be segregated out, so you don't have to have the whole lobby taken apart at one time. We're looking at potentially using not only a Franklin Street entrance because of the city's issue with the repaving, but we're also looking at what would be considered the Genesee Street entrance on the side there that you can enter into. So we are looking at all kinds of facets associated with the convention center. We've already done an analysis. We know how much it would cost. I think it's a little over $10,000 on a weekly basis for the convention center, for its staff that has to be there, its heating, its electrical. So we've done a lot of the behind the scenes work. What we would do going forward is if the state says, yes, we want to use the convention center as a mass vaccination site, working with the county and the National Guard, is we would all come together and figure out, okay, what's the best way logistically inside the facility to do it? So are we using solely the ballroom? Or do we say, no, we don't use the ballroom, we use the main exhibit hall? And if so, in the main exhibit hall, what size of the main exhibit hall do we need? And then, of course, we need to ensure that we have all the proper infrastructure associated with that. So we've done a lot of the pre-preparation, but when you talk about bringing in partners, you need to basically walk the facility. Like we did last year with the Army Corps of Engineers when we were considering turning the convention center into a COVID-19 only hospital, in which the Army Corps of Engineers were provided the schematics associated with the convention center, so they knew the electrical loads and things like that. We would do the same process with the state and the National Guard when that time comes. We know it can be used. We know there's some logistical issues that we're going to have to deal with, especially associated with the two projects, the county's project to redo the lobby, and most importantly, the city's project to repave Franklin Street, which is very much needed. So we didn't tell the city don't do it, because we need that project done. It really needs it in front of the convention center, especially with the work that Doug Jamal and his team are doing with the Statler now. Really makes the convention center a better place. But we know there's work that would still have to be identified for the logistics associated with it, but a lot of the the top-level analysis has already been done. So, thank you. With that, I appreciate everyone for being here today. This should be our only COVID-19 press conference for the week, though I've talked with Dr. Gelberstein, and we may have some announcements later this week with regards to opiate usage for 2020, because we have some pretty strong numbers associating with opiate usage. And what, unfortunately, people laughed about when I said it last year, the much higher level of people who are dying from an opiate overdose because they think they're just using cocaine, but it's spiked opiates. So we're talking about holding a press conference later this week on that. But otherwise, for COVID-19, this should be the only one this week unless something drastic happens. And most importantly to all, if you're out in public, make sure you're masked. I have an N95 and a procedural mask. I'm double masking, and you should double mask when you're out in public. And you should continue to follow the precautions that are in place, wash your hands and the like. There's a reason why our numbers have gone down. There's celebrations coming up. We've got the lentil season coming up, and I wish everyone a very happy Tuesday with Fat Tuesday, but don't go out celebrate. Just eat at home with your family. Punchki Day, go buy some punchkis, wearing your masks, and go home. And on Ash Wednesday, have a very solemn Ash Wednesday. And as you're celebrating the lentil season, do it safely, because we know what happened when people gathered for Thanksgiving and Christmas. Our numbers went up. We do not want to see that happen as we get closer to Easter. So be safe and well all, and thank you, Kendra, once again for all your work.